Okay, so we're going to start with the urinary system. And basically, the functions of your kidneys mostly are it secretes renin, it secretes erythropoiesis, so it creates red blood cells, and it makes your vitamin D activated, and it balances out your fluid acid bases, and it creates urine. Obviously, the kidney makes urine, and of course, it'll also remove your metabolic wastes. So with that, I will remember red BOM. Red standing for secreting renin, E standing for erythropoiesis, D standing for vitamin D, B standing for balance, U standing for urine, and M stands for metabolic wastes. So there you go, you have the functions of kidneys. And if any of your patients ever ask, what does the kidney do? Why do I need a kidney transplant? So the anatomy of the kidney, I'm going to go over it very briefly because we've already learned it in our anatomy lab. So the nerve supply of the kidneys are the sympathetic nervous system, ganglia. It forms the renal plexus. It follows the vascular system to the individual nephrons. And what is a nephron, you ask? Well, we'll talk about it later, but basically it has a renal capsule and a glomerulus. So the blood supplies of the kidney goes from the abdominal aorta to the segmental arteries, to the lobar arteries, to the arcuate arteries, to the interlobar arteries, to the afferent arterioles, to the glomerulus, to the efferent arterioles, to the paralobar arteries, to the venues or the vasa recta, to the interlobar, to the arcuate, to the sorry, that was interlobular before the arcuate veins. Sorry, we're no longer on the arteries. And the interlobar veins to the renal vein, and you go to the inferior vena cava. So basically, your kidney gets 20 to 25% of your resting cardiac output. That's about 1,200 milliliters per minute. So a lot of blood goes through your kidneys. Externally, there is a hilum. It's the middle part of the kidney. The kidney is like a bean shape. There's a little hilum. There's a ureter that comes out of it, the blood vessels, the lymphatic nerves. There's the renal sinus, is the internal space in the kidneys. And there's 3 layers of the kidneys. In case you don't know, most things have 3 layers in your body, like the heart. So the outermost is the renal fascia. It connects to the adrenal glands that sits on top of the kidneys. The middle part is the adipose capsule, excuse me, and that has a lot of adipose tissues to keep your kidneys cushioned in case you get hit in the kidneys. And you also have the renal capsule that separates the little kidney compartments. That's the most inner layer. And you have the renal pelvis that goes to the major calyx, the minor calyx. The route out of the kidneys are from the collecting duct to the papillary duct to the minor calyx to the major calyx to the renal pelvis to the ureter to the urinary bladder. So now you know how the urine goes out of your kidneys. Beautiful. Okay, so now we're going to talk about nephrons, and I'm probably going to stop after talking about anatomy. We'll take another, quick video for the renal physiology after this. So basically, there are 2 types of nephrons. There's the cortical, that's about 85% of nephrons are this kind, and they are for the secretion and reabsorption. And then we have the juxtamedullary. They are for forming concentration of urine. because they have the vasa recta. Okay, so I already told you there's a glomerulus. There is the renal capsule. Has like a Bowman's capsule, and it has the parietal layer, which is simple squamous usually. It has a visceral layer. It's a modified simple squamous, and has podocytes that adheres to the endothelials of the glomerular capillaries. And you also have special components of the nephrons. You have the juxtaglomerular apparatus, which is, hold on just for a moment. We are back on track. It's in the DCT and afferent efferent arterioles. In case you don't know, DCT is the distal collecting tubules. It's modified smooth muscle. It's mechanoreceptors. It contains renin. So if any ask you what secretes renin in the kidneys, you can tell your patient, oh, it's the juxtaglomerular apparatus cells. So, oh, and you also have the macular densa in the DCT that does the osmolarity, the NaCl levels. So this regulates the rate of blood flow and how much filtrate you have. Okay, and you also have filtration membrane, special component, very intense. There's 3 layers. Yeah, there's the capillary endothelium, the basement membrane, the visceral membrane. Again, the visceral membrane, like the Bowman capsule, have podocytes. The glomerular capillary lets in water, small solutes, and the filtration membrane stops your plasma proteins from going into your kidneys. We also have the mesangial cells. It increases the surface area and it phagocytoses and contracts for the kidneys. So if anything that's not supposed to be in your kidneys gets in there, your little mesangial cells are there to help you out. So now we're going to go to the renal tubules. That's probably all the time we're going to have. So you have the PCT, you have the proximal collecting tubules, and it's the simple cuboidal. It has a prominent brush border to increase your surface area and lots of mitochondria, and you do most of your water reabsorption here. You also have the loop of Henle. It's a descending and ascending limbs. There's the thick and thin segments. So in the descending, you have the thick cuboidal, clumer epithelial, and then there's the thin segments that goes like this to the ascending. Sometimes you have it, sometimes you don't in the ascending. And it's the descending that lets water out, and it's not permeable to solutes, but the ascending that's permeable to solutes but not water. So I think of water falling. So it's the descending that lets out water in the loop of Henle. OH. And then you have the distal collecting DCT. That's either cuboidal or there's a few microvilli. And we'll go over what they reabsorb and what they secrete later in another video. So now you know the kidney's anatomy and functions. We'll go over renal physiology next.